Hello, welcome viewers to Healthy Wrinkles, the channel devoted to the healthcare of elderly and senior citizens. We have pleasure today to have Dr. Nasreen Rustomfram, and I'll quickly introduce her to you before I jump into asking her questions in the area of specialization. Dr. Professor Nasreen Rustomfram, she holds a doctoral degree from the Tata Institute of Social Sciences, which is a very well-renowned institute in Mumbai, and everyone is aware about it. Having completed her post-graduation in social work from the same institute, she has worked for 42 years, a very long career where she has done a number of assignments, and some of the work that I'll be introducing what she has done. Of the 42 years, 35 years has been with the institute, Tata Institute of Social Sciences, and 7 years she has been working with NGO as well. So her experience is really well-rounded as far as the social work is concerned. Doctor, one of the important point is that I think something needs to be done, and I'm sure something must be being done to popularize or publicize, or or maybe communicate about these services to the right set of people, so that rather than waiting till till it is really late, at early stage, the people are brought to you, kind of thing. So
yeah, you are right.
is there any effort being put in that direction? Any society, any body, or any such effort?
Yes, there is a good deal of awareness now, and greater awareness is being sought to be created. And at the same time, that is why now courses in geriatric care are not considered to be those which only train somebody to look after a person medically. Equal importance is given to the social understanding of the individual, and not to regard the individual as a patient, who has come to you with depression or with signs of anxiety or anything like that, but that they have to be seen holistically. And as I said, very commonly, people actually go to a medical professional with some bodily symptoms. So they may go with a headache or indigestion, or vomiting, unable to fatigue, all those kinds of things. And it is only in the diagnosis of that it is also understood that there might be something which is non-physical and which is of a mental nature. So in this situation, we are trying to make actually a social cadre of workers. And that's where the gerontology comes in, because we've been referring to geriatric so far. So
Right.
geriatric is the medical or the health aspect of a senior citizen's life. Whereas gerontology is an interdisciplinary set of subjects that are studied to understand the older person in their entirety, in a comprehensive manner, rather than only from the point of view of health. So at the Tata Institute of Social Sciences, we began actually with gerontology. Sometime in 2007, we discovered that there were some organizations working for the elderly, but they did not have any trained personnel, working with. So we offered this course in a sense that they would be able to, the persons who trained in this course would be able to look at the senior citizen from all the aspects, physical, social, recreational, even help out with, say, legal issues, and also help out with all mental health issues, family relationships, intergenerational bonding. So, gerontology covers all the aspects of an individual's life. And geriatric covers mainly the health or the medical side. So what we are doing is, through training people with a social orientation, even if they go into the field of geriatric care, we are emphasizing the fact that social care and social and mental issues require the same amount of importance as physical care.
So what are the commonly qualifications that typically these counselors they would have, and then they would typically practice in, say, with hospitals, with other social NGOs, or like independently? How one finds them and approaches them, like?
You see, a professional counselor typically is somebody who holds a postgraduate or a doctoral degree. So unfortunately, in our country, counseling is still not considered as a licensed profession. Actually, it requires a good deal of monitoring and regulation to ensure that people with 4 weeks of training or 8 weeks of training also don't end up calling themselves as counselors. So abroad or in the West, if you see, it just cannot be done. So it's in that sense. For example, in the medical profession, you would immediately call the person a quack, and you would say कि इसके पास तो जाना ही नहीं है. You cannot go.
Correct.
But unfortunately, in counseling, in social work, in some of these other disciplines, these regulations have not become so sort of legal and steadfast, and it needs to be done. There are associations of counselors who are working towards this, and greater sort of efforts and advocacy needs to be made to see that who do we call a counselor is a person who has a professional postgraduate degree at least. So from this point of view, counselors would be found in hospitals, they would be found in NGOs or social organizations, and they would also be found in personal practice. They would be consultants or clinicians who have set up their own practice.
So will they also typically work with the other medical doctors also as an associate of those medical doctors?
See, it's very helpful actually if a counselor is in a medical setting. In that case, the medical establishment is also aware of the fact that a counselor has their own set of specialization, that they have a niche and a particular area in treating a patient. And so we do find that where the two exist side by side, they are able to work together better. And they are able to refer cases to each other, in a more normal sense.
Right.
Yes.
And doctor, what are the sort of normal types of interventions a counselor will undertake? Like because he or she may not be prescribing drugs, so so what is the kind of what type of interventions they would undertake?
So the interventions are like. At the start, when I made a difference between a developmental intervention and a therapeutic intervention. So in that sense, the approach to counseling would vary according to what the problem is or in what way it is diagnosed. Developmental counseling would proceed very much on the lines of encouraging clients to set goals for themselves and then to identify the solutions that they can look for. Therapeutic counseling would be more in the nature of being able to apply certain concepts, certain theories. So, for example, there are counselors who practice rational and emotive behavioral therapy, or they may be practicing cognitive therapy. And different counselors adapt themselves to different types of counseling approaches. And it's not that they discuss those with the client, but here, since we are responding to the question on what are the kinds of approaches that they would use, then there are counselors who prefer to follow, for example, the Jungian understanding or the Freudian understanding, or or RABT or cognitive therapy or narrative therapy. So there are different kinds of approaches, theoretical approaches, and counselors are sometimes specializing in a particular way of dealing with clients.
Yeah, I think wonderful, Dr. Rustomfram, and a great interaction. And I think there is completely new area from a layperson's point of view. And
Yes.
you explained it in a very very simple language, so that
Yes,
everyone can understand and appreciate. And I'm sure people will start using these services to greater extent and more in a preventive fashion, if I use the word, rather than a therapeutic fashion. I mean, earlier rather than later. I think that the best value probably will be driven at that point of time. Yeah. So thanks once again, doctor. And then we would request at some point of time later with other relevant topic related to the geriatric or gerontology, if I use the word, and come back to you again.
Certainly.
So thanks for your time once again, and it was great to have you today.
Thank you very much for having me. All the best.